and welcome to a brand new edition of Skin Sense. I'm your host, Jeannine Mazurkiwecz, and on today's show, we are possibly going to save your life. We're talking about mole removers, and we're talking about tag removers, and we're also going to be talking about eczema later on the show. So thanks for having us in again.
Well, quite welcome.
Who is this lovely lady we have with us today?
This is our Jamie, and Jamie is our full-time physician assistant.
Okay.
So, which I think is kind of important too, because a lot of female patients are a little, apprehensive about getting full body checks, especially by me. But no, and now we have a female, so which is great, and she's basically here full time. So, for any of you females who are uncomfortable, perhaps seeing a male doctor, who want to get examined from head to foot, Jamie is here, which is great.
All right, so Jamie, tell us about these moles. People at home who have moles, maybe for years and years and years, what should we look for, because they can be deadly?
What you should look for is called the ABCDEs of
so melanoma recognition.
Okay.
So and it's very easy because, if you think of ABCDEs, then you can't really forget what we're talking about, and it's very easy to associate.
I think they keep adding on a letter, because when we did this show years ago, it was the ABCs, and then it was the ABCDs, and now we're on E's.
Yeah, now we're on E's.
What do they all stand for? Let's start with the...
the first one is asymmetry.
Okay.
And that means if a mole looks different on one side compared to the other, that's something that you'd want to get examined.
Okay.
Border is the second one, and that would mean a mole should look symmetrical. It should look well demarcated, having smooth edges, and if it doesn't, it can be irregular, notched, or blurred. You'd want to get that examined, of course. The color should be the same throughout. If it's, black, blue, tan, brown, red, or pink tinted, multicolored, chaotic looking, that's certainly something you'd want to get examined. And the diameter, we always say that it shouldn't be larger than a pencil eraser.
Right, if you can fit a pencil eraser over the mole and not see the mole, we don't get too excited about that mole. So yeah, small moles usually a lot safer than, say, larger moles.
Okay.
And the last one would be evolution, which is if a mole is growing, changing in size, shape, or color, and or if it's bleeding, itchy, or tender. That's something you definitely want to get checked out. And that's why we recommend full skin exams yearly to all of our patients, especially those who are at higher risk with, family history of skin cancer.
And it's important to realize that even a mole, if it doesn't look like it's changed, but if it starts to itch, itching can be the first sign that it is changing. And you don't really see anything, but you feel something. So if you have any moles that itch, by all means, you want to get them checked out.
Obviously, there's a lot of studies done because skin cancer, a lot of people can get skin
there's
cancer.
2 million new cases of skin cancer a year, which is staggering. When I first started doing the show, I'd say 1 million new cases. That sounded like a lot.
Right.
Well, now there's 2 million plus every year. So the incidence is obviously getting, increasing. And you can ask me why isn't it increasing?
Is that due to more people using tanning beds at a younger age? And I know there's been some laws now that are going into effect across the country, making the age, I believe, is it 16 or 18?
Well, in California, you have to be 18 or above to even go into a tanning parlor. But, when you go into a tanning parlor, what you're getting is very concentrated radiation. And it's been shown that this radiation will actually cause the worst kind of skin cancer, which is malignant melanoma. So we tell our patients, forget the indoor tanning. I mean, that's out. There's been a great increase in melanomas in young females, especially young white females who are middle class and wealthy. Why? Because they're the ones who can afford the time and the resources to go indoor tanning. You don't want to do that. If you really want to look tan, go to a spray tanning booth or get spray tan, or get the self-tan. Yeah, it's perfectly safe. It's actually made from a food dye, and you won't be getting wrinkles, and hopefully you'll be perhaps saving your life as well.
Now, Jamie, you're a young girl. Would you ever use a tanning bed, or have you used a tanning bed?
No, I have never, no. And when I do go outside and daily, I use SPF of 15 or above on my face daily with a moisturizer. And I have never gone into a tanning bed.
I know we have some young girls watching, and I know that they have the mentality that it won't happen to me. What do you have to say to them?
You never know if it could happen to you. If you do tan, I'd recommend coming in and just getting an exam of all of your moles to make sure, because we're trained, Dr. Schleicher has trained me what to look for, and it's just better to be safe than sorry.
All right, well, we have a guest coming up. We asked for a guest on our Facebook wall, and we got one. Kim Barbush is here, and we're going to introduce you to her, and Doc and Jamie are going to do their thing. I might have to close my eyes, but we're going to do a mole removal, and later in the show, talk about skin tags, and also if you have eczema, stay with us here on Skin Sense. Welcome back. Again, you're watching Skin Sense here on SSP TV. I'm your host, Jeannine Mazurkiwecz, and we're informing you about moles and what to look for. We already explained what to look for if you've had a mole for a while and it has changed colors. And now we have our guest with us, and it's Kim Barbush. She's actually a friend of mine, and thank you, Kim, for coming. We'll meet Kim in just a bit, but right now we want to focus on a mole that she has on the back.
Absolutely, and you can see the mole here.
Okay.
And this mole, fortunately, doesn't look suspicious. Okay, there is a little bit of color change. You can see at one of the poles here. So that's one of the signs we do look out for. But according to Kim, and you can see it's by her bra. So any mole that's by the bra that's chronically irritated, that may itch or whatever, well, sooner or later you may want it off, because there's no sense having a mole that's constantly traumatized. And a mole such as this one is actually very easy to remove. Certain moles that are flat, sometimes they're a little more difficult because we actually have to put stitches in. This one, no, we wouldn't even need stitches. And basically what we do is, since we like Kim, we'll actually numb this mole up.
Awesome.
So,
that's nice of you.
Thank you.
and if she's really talkative, we put her to sleep. But we don't have to do that. I'm just
Kim.
kidding. Okay, we don't usually use general anesthesia in the office here. And what we use is something called xylocaine, okay, which is a common numbing agent. And you can see we put it's going to pinch a little bit. And we put this agent right under the mole itself. It's like a little mosquito bite, a little bit of burning, as you can see.
Are you okay?
And we raise actually a little wheel or a little
okay.
bubble. And that makes it actually easier to remove the mole.
See that?
So yeah, you can see that. And interestingly, this little numbing agent has an ingredient called epinephrine, and what that does, it constricts the blood vessel, so you can see this little white area around there. And why do we do that? Well, it doesn't bleed as much when we do that, okay? And you can see, it doesn't take very long for the mole to numb up. Actually, it's probably all numbed up now, and we can test it. You can tell me if I feel sharp at all or just a little pressure.
I don't feel nothing.
So, but again, you can take a closer look and you can see around the border there is some pigment. And pigment's one of the signs we look for as far as a mole changing. Certainly if a mole has very dark pigment or certain shades such as red, whites, and blues, very easy to remember. Those are bad signs, okay? So if you have a mole with those shades in, that you really want to get checked out. And it's very, very easy to check moles out. Most of the time, we just look at them. And the majority of moles certainly don't need to even be biopsied. We can just check them every year if need be. And we tell people if there's changes of moles, yeah, you bring it to our attention. So what we use, the easiest way to take this off is to use a little blade, such as we're doing now. An alternative would be to just take this whole thing out and put stitches in. Well, that to me is overkill. So why we don't want to, there's no reason to do that. And then what we're doing, and Kim, you let me know if you feel any of this.
Okay.
And basically, the mole that was, how many years did you have that mole for?
Since I was little.
Right, since you was little. Well, guess what? That mole is gone. Okay, it is gone. Of course, Jeannine just passed out in the background here, but
I have to admit, you definitely shut me up.
Yeah, shut Jeannine up. So that's good. And this is it. So we just need the little zapper over here.
And that didn't hurt at all,
And then-
correct?
No, nothing.
I don't think we've ever removed a mole that big.
That's
We've done mole
exactly.
removal before, but only the cookie cutter one.
Exactly. So then we use this little instrument here. And what this does is it cauterizes it. And this is that. And you can see.
Wow,
Now,
and
within a
it's-
week or two, this thing will be healed up. Back's a little slow healing compared. We do them all in the face. Usually in a week, it's totally healed. This might take 10 days to 14 days. She'll have either a little light spot back here. But the good thing is, too, any mole we take off, we analyze, because you can never tell 100%. And sometimes we're surprised that
Okay.
yeah, so that a mole that just doesn't, look suspicious, well, actually underneath the mole, it turns out to be suspicious. So we actually did the patient a favor by taking that mole off. But you can see this mole is gone. It's perfectly flat, which is great. And you saw the whole procedure takes not very long.
Not very long.
Okay.
Painless.
Basically painless. Okay, it's just a numbing medicine, and that's it. We put a Band-Aid on. We tell people keep the Band-Aid on for, whatever, 5 days, 6 days, either Aquaphor, which is an over-the-counter ointment, or if you're not allergic to it, Neosporin or bacitracin. And the mole is gone. Now, it takes about a week to get the mole checked. By checked, we mean we send it out to an outside lab, and then they actually cut it up and look under the microscope just to make sure there's nothing wrong with the mole.
Now, we talked about moles that we remove, and you also do tags. So we're going to flip Kim over and get that removed for you too, Kim.
Kim is
All
the
right?
ideal patient because she
is.
has both.
She
So
has both.
we're
2
going to
thumbs
do
up.
a skin
Thank you,
tag.
Kim. All right, well, again, we have Kim flipped over now, and this is, again, by the bra line, so another good reason to get that skin tag
Yeah,
removed.
Kim
How
was-
long have you had this?
A while.
Okay.
Yeah.
Kim was very gracious. She grew 2 skin lesions
you.
just for the show. It's like
What a good friend.
unbelievably great. So, but anyway, this is what we call a skin tag. Medically, you call them acrylcordons, but skin tags are usually connected by a little stalk, such as we see here. Now, skin tags are like the most trivial condition you can get, but they're very, very common. And the reason why a lot of people get them off is because if they're under your neck or on your bra line, obviously they're going to get irritated, besides the fact they don't look that good. But the good news is they're very, very easy to get off. And the other good news is they never become skin cancers, okay? So we don't have to worry about that. But we do want to get rid of them. Oh,
Now, I
we
guess
have
you
her
don't
here.
suggest trying to rip this off.
No, but there's an old-fashioned remedy where
I've done that with a mole before in high
No, you
school.
don't want to do it with a mole.
I had a
But
mole on the side of my neck, and I
Did you graduate high school?
did.
Okay, just
How
checking.
So you don't recommend that you pull something like this off?
No. I mean, there's an old-fashioned remedy, and what you can do is take like dental floss and tie it around the stalk.
Okay.
And that sometimes, kind of strangulates the mole.
Okay.
But we don't usually recommend it for that.
You don't do it
'Cause-
like that?
Yeah, I wouldn't recommend it, but it's so easy to do.
So you numb this
medically.
the same way that you numb the mole.
Exactly.
Okay.
Numb the same way. You can see she didn't even flinch. All right. And you can see this little white area here, so we know it's numbed up.
Okay,
And
might
with
have
a
to turn
mole,
away from this
The
part.
majority of moles. Now this is actually a bigger skin tag. A lot of people have these little tiny skin tags
Mm-hmm.
that we can just take a little electric needle and zap them, and that's it. They fall off within a day. But this mole is big. So what we're going to do is actually take this mole off with this little scissors. And this is it. This is the skin tag. And you can see perfectly flat. Will never grow back again. What we're going to use is our little electric instrument just to ensure that it doesn't grow back. And
Can
we
they
will
grow
be in
back?
great shape. It'd be very unlikely. Very unlikely. But this will guarantee that it will not grow back.
And do you have to
So-
test the skin
Skin
tag?
tags, no.
Okay.
Since they're so common, so trivial, we don't worry at all at skin tags, and we don't test skin tags. But you could see it was a very, very simple procedure.
Mm-hmm.
You did fine, right?
Yeah, it didn't hurt
You know,
at
and it's
all.
amazing because I've seen skin tags that are probably, some are actually the size of a golf ball.
Wow.
Okay, and when a guy pulls down his pants and says, could you take a look at this? He's got a skin tag size of a golf ball that he's had for years and years and years. And guess what? It's just as easy to take that off as what we did here.
And you're sure it was a skin tag?
And hopefully,
Yeah.
hopefully it's not really a golf ball. So then it's kind of embarrassing.
Did you remove the skin tag?
Yeah, saying, sir, it really was a golf ball.
Yes.
You better check your golf game. But yeah, so, well, anyway, we put a Band-Aid on here. Oh, we put the Band-Aid on. Kim's going to do great.
All right,
okay.
we'll let Kim get adjusted and we'll answer some of her questions and some of your questions at home. Again, you're watching Skin Sense here on SSP TV. And welcome back to SSP TV. You're watching a brand new edition of Skin Sense, and we're talking about mole removals and tag removals. And Kim is the perfect patient to have on the show because she also has eczema.
Yeah, it's amazing. She grew everything for the show.
Thank you, Kim.
So I don't usually recommend that, but in this case it was very, very helpful. And what is eczema? Well, eczema is a skin condition in which you basically dry out. And you dry out, and as a consequence, you become itchy and you become red. How common is eczema? Well, it affects about 10 to 20% of kids. So it's really common, and the incidence is actually increasing. It's related somewhat to asthma and hay fever. So we see some family members who may have either of those other conditions. And it's very common, and the problem is it's itchy, as you probably know. And it gets worse in the wintertime with the cold weather and with the lack of humidity. So it's a major problem. I mean, it's not a real serious problem, but it can keep people awake at night, and it's just no fun itching all the time. And Kim, if we could see your arms, she has classic eczema, and you can see the redness here, and you see the location. The eczema usually affects the arms here, okay, is the opposite side of the elbows. It can affect the neck, and it can affect behind the knees. And individuals with very, very severe eczema can actually have their entire body coated. Now, when you were a kid, did you have eczema worse, would you say, as a kid?
Worse.
Yeah. Fortunately, a lot of adults tend to grow out of eczema. But you can see, I'm sure this is very, very itchy. And you haven't used any medications in the last few weeks or months.
No.
The good thing is eczema is fairly easy to treat, and there are prescription creams which will afford relief to the vast majority of people who have eczema. Some people do require pills or a shot if it really gets bad. And again, you do want to treat it because, you know, why spend your winters being miserable? Eczema is helped by sunlight, but somebody like Kim who has very fair skin, well, we have to be careful because, you know, sunlight can actually contribute to aging, to wrinkles, to even skin cancer formation.
Now, a question on the eczema, because does eczema go along with having allergies or asthma? Because I know my son, he has allergies, and we use a cream from here, and he gets the same thing in his creases.
Definitely, because people think that eczema is basically an allergic reaction that occurs on the skin.
Okay.
But again, people with family members who have hay fever or asthma are much more prone to have eczema. And I don't know if in your case, if you
I have allergies real bad, yeah.
Okay, yeah, so
Do you have
that all
asthma?
goes along
No,
with
I don't have asthma.
Because my son doesn't have asthma either, but he has the eczema.
Right, and you know, it just so happens, it's an amazing coincidence that we're going to be testing a new topical cream for people with eczema. So I would advise anybody who has eczema, to this extent, you know, to call us, because I think it's a limited number of people we can put on the study, and they actually give you the cream and they pay you to use it. So, and you know, it's a harmless cream, but if it works, that would be great, okay, because it would afford relief for somebody like you. And again, we are just starting testing of the cream, so definitely give our office a call, 459-0029. If you do have eczema, if you want to go on the cream, you'll get free cream, and again, they'll pay you to use the cream. And it's only a 4-week study.
And it'll help you with your skin to look better, and if you like the product, something you could continue.
One of the things we should mention, people who have eczema obviously have dry skin, which means you want to use soaps that are moisturizing. You want to limit the amount of baths or showers you take. 1 a day is fine, because if you overly wash, you're going to dry out your skin even more. And of course, people who are housewives or people in certain businesses, well, they have to continually have their hands in water, and that's not good for that's not good for eczema, okay, as you've probably found out the hard way. And areas where she is just dry but not red, those are the areas when you want to use an over-the-counter, or perhaps even a prescription moisturizing cream, just to keep moisture in the skin. And when you use one, if you do take a bath, within a few minutes of getting out of the bathtub, even when you're still a little moist, you want to use the moisturizer because you want to trap that moisture under the skin, and you want to keep moisture from leaving the skin.
I've actually moved my lotion into the shower because it's cold,
idea.
so you want to do it as soon as you're moist
Real good
and your
idea.
skin is still, you know, a little bit wet.
Yes.
The other questions, we wanted to hit on one or two questions on the skin tags and the mole removal. We talked about what to look for with their moles. Are there any common questions that people ask concerning the moles or skin tags, or did you have any questions that you wanted to ask?
How long does it take to, or what happens when it comes back and there is something? Then what
Well,
do
in
you
a
do?
rare circumstance, certainly with a mole like you, it depends. Sometimes they'll say there's atypical cells there. And that means the mole could possibly change over time. So generally, if that's the case, then we'll actually go back and take a small area out and put stitches in just to be safe. Now, even more uncommon is they'll come back and say, well, you actually have a skin cancer. And the skin cancer that develops from a mole, or vice versa, is a malignant melanoma. That's the most serious type of skin cancer. So you don't want to fool around with moles. And one of the problems we see, well, for instance, yesterday we had a kid who came in who had 200 moles. Okay, his entire body is covered with moles. Now, what do you do with a kid like that? You're not going to take, and some are suspicious, but you're not going to take off every mole. But what you are going to do is check that kid back every 4 to 6 months. And we have a special magnifying lens, so if we see anything that looks suspicious, we'll actually blow it up and check the mole out that way.
Is that hereditary?
Yeah,
200
moles are
moles.
by and large hereditary predisposition. And individuals who have family members with skin cancer are much more prone to getting skin cancer.
And you should really check your spouse or check your friend, because the back behind the ears, I had a friend who saw a mole on her dad's ear and it turned out to be something, and luckily he got it removed quick enough.
That's a great point. And a study was just actually published about 3 months ago in which they analyzed hairdressers, and about 40–50% of the hairdressers were actually doing their patients a favor by looking, because who thinks of looking in there? You can't see your scalp, and who's the best to see it? Well, your barber or your hairdresser. So I urge anyone who is a barber or hairdresser, or if you deal with the public from, you know, if you're a massage therapist or whatever, check your client's skin, because you may indeed be saving their lives.
Even your doctor, anytime that you're exposing the skin in areas that you normally don't do, even in your, you could get a mole underneath your armpit and not really notice it.
Definitely, and you can see it's so easy to check out a mole. Okay, of course you want to go to a physician who has experience with moles, because you know, some moles may look serious and aren't, and vice versa. Okay, so you want to be a little bit trained in what to look for in a mole. But yeah, by all means, if you have moles, yeah, at least once in your lifetime, get them checked. And if any mole changes, well, you want to do that more frequently. And if you have a family history or personal history of skin cancer, yeah, you want to get those moles checked on a regular basis.
Well, we're running out of time, but Kim, thanks for coming in and being the guest on our show. We'll keep you updated on the next show how the results came. I'm sure they're going to be okay, though. And we're also going to be talking about on our next show, radius. Again, a lot of questions came in, and a lot of women and some men concerning radius and fillers and Botox. We're going to talk about that on the next Skin Sense. If you have any questions, you can email me direct at Jeannine@ssptv.com. Check us out on Facebook, Jeannine SSPTV, and you can check our listings on SamsungProductions.com or SSPTV.com. Thanks for joining us here on Skin Sense, and we'll see you next time.